from the Toronto Star. I'm Reggie Munder, and this matters. Rhinorrhea, the sniffles, mucus, snot, boogers. Whatever you want to call it, all parents know that kids will have runny noses. But in a pandemic schooling world, it's one of the most frustrating symptoms, which have had parents rushing for COVID tests or pulling their kids out of school as a precaution. Recently, the Ontario School Screening Guide has made an interesting decision on runny noses, one that might best be described as being more user-friendly for parents and families, but still leaves some questions about its scientific basis. The real issue is the largest cohort of people who have remained unvaccinated are children under 12. And with Delta rising in the community, it is easy to understand why parents are approaching this school year with trepidation, anxiety, and a healthy dose of skepticism. Jennifer Yang and Megan Ogilvie are health reporters at the Star. They are here to talk about symptoms, screenings, and back to school. Jenny and Megan, thank you so much for making the time to join us once again.
Thanks for having us.
Oh, we're happy to be here.
So guys, listen, you are stellar health reporters, but I'm going to out us all as parents here. So we are also all very familiar with kids and runny noses. Now, in a pandemic schooling world, a case of sniffles has been a very big problem for parents and institutions. Let's talk a little bit about why, but then also there's been some news surrounding this, in particular as it returns back to school. Megan, I think you're going to start with this. Why have runny nose been a symptom that's sort of on and off throughout the pandemic?
Yeah, you're right. Any parent or staff member at a daycare or a school, it's that runny nose that's caused, I don't want to say problems, but lots of concerns over the last year. Is the runny nose because of allergies? Is it because your kid has come in from the cold and is now warm and the nose is running? Or is it just like the common cold, or is it COVID? It's so hard to know, especially with like the little people who can't tell you exactly how you're feeling or how they're feeling. And so parsing out how a runny nose fits into the pandemic has been tricky. It's caused so many, for me, it's caused so many worried nights about what to do about it. And for teachers, do I call home about it? And I think for policymakers, maybe they've never spoken enough or argued enough or thought about as much runny noses as in the last 18 months. We do know that it can be a symptom of COVID in some cases, but we also know that it can be a symptom of so many other things. So trying to figure out how it fits into our COVID life has been tricky. And here, heading into the new school year is like the latest iteration of what to do with runny noses in a pandemic.
So I believe runny noses have been pulled on and off of the screening guide up to 3 times. As we enter this new school year, it's just been sort of removed as a symptom from the screening guide due to probably some of the confusion over some of these issues. So while perhaps this is a relief to some parents, Jenny, what is this based upon? Is there some science here?
There appears to be some data that the province is drawing from. I actually asked the Ministry of Health what data they were looking at to inform this decision to remove runny noses as a screening symptom for little kids. Because the Chief Medical Officer of Health actually raised it in a press conference earlier in August. He said, runny noses are coming off the list. We've heard parents loud and clear. It's so disruptive. And we found actually very low positivity rates in kids with just runny noses. So I asked the province, I said, show me the data. And they responded, and they actually only pointed to one source that they looked at. And it sounded like they might have reviewed other sources as well. But I think one of the major sort of new pieces of research is a preprint study out of Ottawa. And a preprint, for those who don't know, is sort of a draft of a study, and it has not yet been published or peer reviewed. But in the pandemic, preprints have been really, really common because we want to get new data and research out into the world as quickly as possible to respond to the emergency of COVID-19. What this preprint did was it looked at over 10,600 COVID tests in Ottawa on kids with just one symptom. And it found really, really, really low positivity rates for kids who showed up for testing just with a runny nose. And actually in the daycare group of kids, so under 5, they found that runny noses were not predictive of a COVID positive test, even though together with a single symptom of cough. So kids with either just a cough or just a runny nose, they made up something like 61% of all tests for this age group. And yet they did not predict a positive COVID infection. So this was one of the things that the province was looking at. And, I'm sure they reviewed other data as well, but that's what they mentioned in my requests to the province when I asked for them to show me what evidence they were basing this decision on. But, if I can just interject with a personal anecdote, even for myself, this is very conflicting because runny noses, I have a kid in daycare. We've had to pull her out of daycare, I don't know how many times, and get her tested just for a runny nose. And it's caused so much chaos in our lives. It's made it so hard for me to work this job as a reporter covering COVID. And yet my kid had COVID in the spring. Some of our readers will remember. And what was her first symptom? It was a runny nose. So, I think that really speaks to the difficult balance here.
I'm old enough and to remember the before times when, your kid got a little bit sick and you made that call. You made that question. You're like, you know what? Can I send this kid off? Obviously, this is something that no one can ever do again in this pandemic world. But from what we do know, runny noses can still be a symptom. What are the symptoms that the screening guide is saying that we really should be watching out for now then? If they are slightly less, or if we can send our kids to school with them, what should we be watching for?
Okay. Well, let me sort of break down that question because first, let's speak about the preprint. So the preprint study looked at just single symptoms, and it found that fever, if a child has just one symptom and it's fever, that tends to be predictive of a positive COVID test across all age groups. When you're looking at just the under fives, they found that actually nausea and vomiting seem to be predictive of a positive COVID test, which I think is not necessarily what a lot of daycare parents are watching out for. You've got the thermometer at the screening, the screeners at the door at the daycare are taking the temperatures, but it turns out nausea and vomiting was more predictive in this study. For school-age kids, there was more symptoms. Headache, runny nose was predictive, and cough. And then for high school kids specifically, sore throat was actually the symptom that appeared to be most predictive. Now, the province's screening list, though, has narrowed down the symptoms that will now exclude a kid from school or daycare and require a COVID test. And so that list of symptoms, I'm just going to have to quickly consult because it's so new that I can't remember off the top of my head. Megan, do you remember what the symptoms are?
They are definitely fever and those gastro symptoms that you talked about. So nausea, vomiting, diarrhea, a cough or like a barking cough, what parents know as croup, shortness of breath, and then decrease or loss of taste or smell. And the symptoms, so in addition to the runny nose, the symptoms that have been removed for this September are on their own, so not in combination, but on their own: runny nose, a sore throat, congestion, and headache. So all those symptoms just on their own have been removed from the guidance. But in combination, I think the experts would say that these symptoms in combination, vigilance should be taken and go for a COVID test.
And, I will say that we did speak to experts this week that were very worried about the idea of removing runny noses from the screening list, especially in the face of Delta, which is a new threat that we don't actually know that much about. And even the study from Ottawa, it's a lot of new and informative data, but it was based on previous strains of this virus. And, I talked to a doctor on Monday who texted me just as we were filing our story, so it didn't make it into the article. But she had just called a family whose child tested positive for COVID-19. And this child, it started with a runny nose. And then there was a sore throat. And then 2 days later, the child developed a fever. And at that point, they went for testing. And it was positive. And the doctor that I spoke with raised the point that under these new screening guidelines, this child would have been at school for 2 days with that runny nose while infectious. So, there are still concerns that we will be missing some cases now that runny noses are not on the list anymore. But, how big of an impact will that have is kind of the big question.
I didn't expect this to be a fun conversation because, like all parents, we are frustrated and burnt out. And I understand why there's a ton of skepticism because I think we're all seeing the science develop in action. I think we should just also be really fair and say the fact that these screening guidelines are evolving, it's not a bad thing, right? Potentially, it could be a good thing because, one, more people could be in school more and potentially dealing with other issues. But I mean, I guess here's a question. Evolution of these things, that's not a bad thing because we are learning more about this virus, right?
That's exactly it. It's not comfortable or easy for parents or schools, but I think we do need to update and adapt and modify protocols and guidance as we learn more about the virus, but also in addition to the changing landscape of the pandemic. So as infection rates rise in an area, maybe there's an indication from the province that public health units can implement more strict screening guidance to control COVID in the school community. We also need to be mindful of the other viruses circulating when they think about current guidelines. So, for example, I wrote a story last February speaking to pediatricians in the GTA who were really warning, and they wanted parents to know that at that time, a single symptom, including a single symptom of a runny nose, was very likely or was more likely to be COVID than at other points in the year. In the winter and early spring, hospitals across the GTA, at least, were seeing a dramatic drop in kids being admitted to hospital for other viruses. So they were not coming to the emergency room for gastrobugs or like asthma exacerbations or other respiratory illnesses. And so when the landscape was sort of barren of all these other viruses, it did make sense that a single symptom could more likely indicate COVID. And they were encouraging parents to go get that test. Right now, hospitals and pediatricians are seeing much more viral illness in kids. So like those runny noses could very likely, that we don't know, are sort of being passed around in daycares and will soon be passed around in schools. Could be COVID, but they're also seeing these other viruses. And so they have to strike, I think, what experts and policymakers were stressing to us in a reporting in the last few weeks, that was also a consideration in these new guidelines, that while other viruses are circulating so much, that having a very strict set of symptoms or screening symptoms would send everyone rushing off to assessment centers for testing. That's not a bad thing if you're looking for COVID, but it's really stressful on first the testing center capacity, and it's really stressful on parents and schools. And I just wanted to add too, heading into the third pandemic school year, the learning loss and the impact on keeping kids on schools as much as possible is another consideration. So having a kid out of school for a week because of a runny nose that turns out not to be COVID is like more of a concern now than I think at any point in the pandemic. So all that to say, right now, these guidelines are trying, I think, to strike a balance between keeping kids in school and catching COVID. That's not to say that they won't and shouldn't be modified in the coming weeks as we see kids go back to school and COVID, hopefully not, but perhaps circulating more widely in the classrooms.
We'll be right back. I know it's a very big question, but a lot of experts you've already talked to, I'm curious what they think the school year is going to look like. I think the one thing that people can agree on is they're expecting a rise in the cases in kids. I know that there's now take-home testing. HEPA filters are in classrooms. How is this year going to look different, or do you think it will?
I've spoken to so many experts who have said that they've never been this uncertain about what the next wave will look like, because there are so many variables this year. In the past, you could look to other countries in the world and sort of who are ahead of us in the pandemic with a wave, and you can pretty much bet your money that whatever happens in Ontario will echo, what happened in the UK or wherever where we saw earlier surges. But because there are so many variables now at play, it's so hard to know what the fall will look like. And some of those variables are different vaccination rates in different countries amongst different age groups. Ontario has actually done better than many jurisdictions when it comes to vaccinating kids who are 12 and older. And, different schools will have different mitigation measures probably, or different ability to adhere to masking and all those things. Ventilation upgrades have been so patchy across the province. They're happening, but we know from STAR's reporting or from our colleagues that many classrooms won't have their ventilation upgrades in place until, close to Christmas. And then meanwhile, you've got Delta, which is a completely different beast, way more infectious. And there are, of course, concerns that it will be more dangerous for kids. We know that it's causing higher hospitalization rates across the board. Is that happening for kids? That's still such an open question. In the US, we've all seen the horror story headlines of pediatric hospitals being overrun, but we still need the data to tease apart whether that's simply because there are so many cases overall, of which a small percentage will impact kids, but because the cases are so high, we're seeing this, spike in pediatric hospitalizations. Is it just a denominator issue, or is Delta actually more virulent for children? That's still an open question, and also something that people are really, really worried about. So, what can we expect from the school year? 100% cases are going to rise, and that will include in kids. But is it going to rise to a level that is out of control, that causes a surge in pediatric hospitalizations, that overwhelms our healthcare system? Like, those are the big open questions.
We're all journalists here. Obviously, I'm a cynic. I saw some teachers recently, and basically the over-under number that they were throwing around was possibly about 6 weeks till another school shut down. Many feel with these rising numbers, it's inevitable. What do you guys think about that?
I understand that impulse, but one thing I've learned as a COVID reporter is that predictions, no one should make predictions because no one knows what's going to happen next. And like Jenny said, there's so many variables starting this school year. We won't know what will happen. I think what we do know, and I think experts have, at least to us and publicly, said that schools are so important for kids. Like, we need to, at this point in the pandemic, make kids, whether in daycare or elementary school or high school, our priority. And society, all of us should rally around keeping kids in school. School should be the first to open and the last to close. And I think what we're seeing from those who are trying to put in place the mitigation measures to keep schools safe is doing as much as they can, as fast as they can, to make that happen. So we reported last week about the Toronto schools will be having these take-home COVID test kits where you can find out whether your kid's runny nose or symptom is COVID or another illness faster and an easier way. Efforts like that are how experts are trying to prioritize children at this point in the pandemic.
Yeah, I recently spoke with Nisha Tampi, who is a pediatrician and infectious disease specialist with CHEO, the pediatric hospital in Ottawa. She said a couple of things that really stuck with me. She reminded me that Ontario has had the longest school closures in the country, not just because of the pandemic, but if you remember, prior to the pandemic, there was a teacher strike. Kids were already missing out on classroom time. So we have, a generation of kids that have had an interruption to their learning that is really unprecedented. And the other thing she said is that school is the essential work of children. And for whatever reason, we haven't protected that essential work as a society, I think, as much as we could have. We are much more concerned about kids than we are for, other age groups for understandable reasons. So I understand the caution and the hesitation around, having schools open and potentially seeing the virus spread. But at the same time, I think our standards for schools have been higher than for any other workplaces. If we had applied the same standards to warehouses and factories, to closing those, sites of transmission, the same standards, if they had been applied there as to schools, that arguably would have had a bigger impact or an equal impact on controlling, the previous waves that we've seen. So she was really stressing that kids have sacrificed so much since the pandemic began to keep adults safe and to keep our seniors safe. And she feels it's really time for the whole of society to do what it can now to keep kids safe, but also keep them in school. And, there are a few ways everyone can do that. But of course, number one is to get vaccinated if you're eligible, because if we can keep this sort of ring of protection around kids and school communities, that sort of just increases their chances of staying in school safely and being able to have a semi-normal school year.
The thing that Dr. Tempe said in your piece that stuck with me was, schools, in my mind, have been a reflection of community risk. This year, I think there will become a sentinel risk in the community. I'm a parent. I am hoping for the best, but I am worried and I am concerned. And I really, really, really hope that our high vaccination rates and all these mitigation factors do work. I think I'm honestly going to be watching this first month incredibly carefully, and I will be ready to pull my kid out at the sign of any symptom, including a runny nose. And I don't really care what the province is saying because that's where I'm at this point. That is my ending rant, ladies. You are the greatest health reporters I know, and I'm so glad that you could join us. Is there anything that I didn't ask that you think our listeners should know?
I think you did a really good job of covering it all. But what you just said, that you're going to pull your kid even with a runny nose, I think a lot of infectious disease physicians will be thanking you for that position, because I think that's what people want to see, because it's very disruptive. But, why take the chance this year is sort of what a lot of infectious disease doctors will say, especially when the stakes are so high. And, even before COVID, why were we okay with sending our kids to school sick, knowing they could spread viruses around and perhaps infect kids who might bring their viruses home and infect their, newborn baby brother who could end up in a hospital with a flu infection or an RSV infection? So, the pediatricians and the infectious disease doctors I talk to say, this is an opportunity to not go back to that normal where we were all just normalizing this reality where we just sent our kids to school with infectious viruses. So, I think the doctors I've interviewed would probably be applauding you for not sending your girl to school with a runny nose.
Megan, is there anything you'd like to add?
As a parent and as a longtime health reporter, I 100% agree with both of you. And so do my kids. They're looking forward to going back to their elementary school for lots of reasons, because they listen to many of my conversations with experts. They know what's going on. So they're a little bit worried about COVID, but I think they don't want to get a cold. They say, I don't want to get a cold. Like, these are the things that we normalize. They had lots of colds in their first few years of schools. If we can all work together to keep our kids happy and safe in schools. And one of the ways to do that is to be mindful of a runny nose, at least for this 2021 school year. I think that would be great for the kids and great for the community.
I really, really want to thank you both for your time today.
Thanks, Raju.
Yeah, thank you.
Jennifer Yang and Megan Ogilvie are health reporters at The Star. That's it for today. Thanks so much for joining us. I'm your host, Raju Mudler. Our This Matters team is Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bachneck, Saba Etizaz, and Sean Pattenden. Our music is by So-Called, Mike DeAngelis, and Sean Pattenden. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.